All right, so this is part 3 of chapter 21. We're going to start with thermoregulation. So our body is going to be able to regulate body temperature, keeping our core body temperature at 37 degrees Celsius, 98.6 Fahrenheit, but we'll use Celsius. The terms for having a decrease in body temperature is called hypothermia. The term for increased body temperature is called hyperthermia. And any temperatures above 41 degrees Celsius is very dangerous, and then temperatures above 43 degrees Celsius is deadly. So it's really important that we keep our body temperatures within a certain range for normal physiological function. So in terms of our heat, we can actually transfer heat between our bodies and the environment, and we do this through these 4 different ways. So radiation is basically how we radiate heat away to the atmosphere, right? So our heat, our thermal energy, moves through these electromagnetic waves. Can't talk this time, right? So you can see the waves coming off of this person. And it just warms up the air around us. So that's why there's a very crowded room. Everybody's radiating heat, right? We have warm bodies. Our warm bodies are radiating heat off into the atmosphere. We're going to warm the room up because, again, we're 98 degrees Fahrenheit or 37 degrees Celsius. That's a very high temperature. It's very rare that you're going to be in an environment where you have a warmer temperature than body temperature. Of course, we have heat waves here in Southern California. We just went through one at the time of this lecture, where the outside temperature was 110 degrees Fahrenheit. So yeah, at that point, our bodies are actually colder than the outside. But under normal circumstances, our bodies tend to radiate heat and lose heat to the environment through radiation. You can also lose heat through thermal conduction just by touching cooler objects. So if you put your hand on a cold slab of cement, the heat from your body will be transferred into the cement. All right, so this is through direct contact. Evaporation, so this is where you're losing heat in the form of water on the surface of your body. So insensible water loss is that you can't sense it. This is where you're not actively sweating, but you will lose water throughout the day just because there's going to be water. You're always sweating a little bit. And the water you're losing is not something that you notice, so that's called insensible water loss. So it's through the skin, it's also through the mucous membranes, and it's not regulated. What is regulated is when you start sweating, right, through sweat glands, and this is going to be according to your body's needs, but this is the evaporation. So when you sweat, you're going to evaporate heat into the environment as well. And then, so here's loss of heat by evaporation of the water. And this is why it's so hard to cool down when it's humid outside, because when we sweat, we are putting water on the surface of our skin, and that water warms up. And as it warms up, it's going to take our body heat, it's going to sort of pull the body heat into that bead of water, and then the water will evaporate into the environment. So when you have a dry air, the sweat is going to be more prone to evaporate. And so it's cooling off in a dry environment is easier than if it's humid, because if it's humid, you have more water molecules in the air. The water is not going to be as readily evaporated, and so the water or the sweat still clings to your body, holding that heat on your body still. So anyways, that's why people in the South, that's why it's so terrible to live in a humid environment, because it's just really hard to cool down. Convection is the loss of heat to moving air circulating around your body, or it could be a fluid. So if you're in a pool, right, a swimming pool, you're cooled down immediately because your body is losing heat to the water. Or it can just be by wind, which is why fanning yourself or the wind chill factor. So fanning yourself can help cool you down by that convection. But also, if it's a windy day and it's cold, it feels so much colder because you're actually losing your body heat to the wind that's moving past your body through this convection. That's why we have something called the wind chill factor, because it is a way that your body loses heat to the environment. Anyways, those are the 4 ways. And this is just a quick look at how we regulate our body temperature. So this is, there's a thermoneutral zone, which is from 25 to 30 degrees Celsius or from 77 to 86 degrees Celsius, where that temperature, when your body is sitting at 80 degrees, something like that, you can mediate your core body temperature. You can still keep it at 37 degrees Celsius by just changing the blood flow to your body. Okay, so the sympathetic nervous system is going to control the blood vessels going to the skin. So when you're hot, the blood vessels are going to dilate. Blood is going to move to the surface of your body to help radiate, right, through all these processes we just talked about, to help move the heat of your core radiated away from your body. So the blood vessels dilating will move more blood that's hot to the surface, and you can lose the heat that way. If you're cold within that temperature range, if you need to conserve the heat, your blood vessels are going to constrict. They get smaller. The heat is going to be contained more in the inward parts or the core of your body, and that's going to help maintain that 37 degrees Celsius. So that's the thermal neutral zone, where you just need to shift the dilation or constriction of the blood vessels in your skin, and you can just maintain your core body temperature. However, outside of the thermoneutral zone, if you're cold, right, so if your body temperature falls, then your body needs to kick in other warming mechanisms, right? So if your body temperature falls, then you're going to have that blood vessel constriction, all right? So your heat is conserved into the core of your body. Your sweat glands are not going to secrete any fluid. There's going to be shivering, which is this involuntary rapid contraction of your muscles, and that's going to generate body heat, right? So the shivering is actually trying to generate body heat. Heat is retained, right, and we return to normal body temperature. If you're warm, your body temperature rises, your blood vessels will dilate, resulting in the heat loss to environment. Your sweat glands are going to increase the fluid that's put on the skin for evaporative cooling, and then and that's going to help cool down your body. And so your core body temperature will come back to 37 degrees Celsius. All right. So these are just ways that we regulate our body temperature. Looking at the sweat gland, there's 2 kinds of sweat glands. If you look at the warm environment part of your outline, there are eccrine glands and apocrine glands. Eccrine glands are going to be the sweat glands. They're secreting water and salt for the most part. There's some chloride there. There's some potassium as well. When you are actively sweating, so you can see that the molecules here are going to move into the duct, right? So your sweat is coming into the sweat duct, and there's mechanisms to actually pull back the water and pull back the salt, but that's going to shift when you're really hot. It's going to allow more water to leave to the surface of your skin. For the apocrine glands, I don't have a picture of that, but those are specialized glands that are found in the armpit and groin regions, and they're going to secrete proteins and fatty acids on top of the water and ions. And for some reason, when you sweat, these are also active, these apocrine glands. And then these substances are going to land on your armpit and groin areas, and then the bacteria, the normal flora on your skin, is going to digest those organic molecules, the proteins and the fatty acids. And then the bacteria will then in turn secrete some other compounds, and then together it creates your body odor. So your body odor is predominantly created by a relationship of your apocrine gland secretions and the bacteria on your skin. And so they think that these apocrine glands are for their pheromones, right? So they're sex attractants. They are sort of these, chemical communication to someone of the opposite sex or whatever, who you're very attracted to. That smell is supposed to be part of that process of act as a pheromone, right? All right. So anyways, fever. Fever is an unusual circumstance. We have fevers when we are ill. We have an infection, and fever is, so starting off, your body temperature is set by your hypothalamus. So the thermostat here that they're talking about is your hypothalamus. And there are certain molecules that are can actually play with your hypothalamus, and they make your hypothalamus reset your body temperature, right? So your hypothalamus, for the most part, goes, okay, our body temperature is 37 degrees Celsius. But in the presence of these molecules called pyrogens, pyrogens can reset the hypothalamus to a higher value, okay? So pyrogens are going to be molecules that the normal immune response will create these. So the white blood cells in your body will secrete things called cytokines. Cytokines in the normal immune response will trigger fever. So they think that fever, of course, it's part of the normal immune response. A lot of different animals have fever. What's not clearly understood is how exactly it helps to help in their immune response. There's lots of different hypotheses and ideas out there, but anyhow, so here's our new set point. So if we look at here's our normal temperature, here's our new set point because pyrogens have been created by our immune system, or pyrogens can be substances on viruses or bacteria, or toxins created by viruses or bacteria. So then if you do ingest bacteria from your food and you have a fever, give like food poisoning, then that substance that's causing a fever is the pyrogens on part of that toxin or part of the bacteria itself. Either way, we have our pyrogens creating this higher set value. And since your brain thinks that this is the new normal, your body is way under that new normal, right? You're at 98 point something degrees Fahrenheit. So you're going to feel cold. Your brain thinks that your body is way too cold. You're going to have the chills. Your body's physiologically going to do all the things to try and warm itself up. It's going to constrict the blood vessels. It's going to give you goosebumps. Piloerection is when your hair stands up on end. You're going to shiver. Okay, and so epinephrine secretion, we don't need to worry about that. But it's going to have this physiological response. And then you're going to raise your body temperature up to where your brain thinks it should be. And that's when you have that fever. Now we know that fevers break, right? So there's going to be a breaking point where your hypothalamus returns back to the set point. But now your body is way too hot for that normal set point. So you're going to start to do things that will cool you down. So your blood vessels will dilate, you'll start to sweat, and that's when your fever has broken. And then your body temperature will go back down. Okay, so these are the symptoms of fever. It's just there are these, chemicals that reset your hypothalamus to a new set point. All right, let's talk about growth. So for growth, this is going to be predominantly mediated by growth hormone, but of course there's other hormones that help in growth, like thyroid hormone, sex hormones, IGFs, insulin-like growth factors. Insulin, of course, promotes growth, right? So there's lots of hormones involved that help promote growth. And when we talk about growth, we mean that you're increasing the number of cells. So you're dividing the cells, making more numbers of cells. You're also increasing the size of some of the cells. So think about your muscle cells. Each muscle cell will get thicker as your muscles get bigger. And you can also increase the bone length and thickness, right? Those are all part of growing. So when you increase the size of the cell, it's called hypertrophy. Increase the size. Hypertrophy. And then if you increase the number, that term is hyperplasia. Okay, hyperplasia is the number. Okay, so let's take a look at our human growth curve. So we have a very big spurt of growth in the first 2 years of life, and then it kind of evens out, and then we have a second big spurt of growth during puberty. And we can see that girls and boys are slightly different. For girls, the growth spurt sort of begins around 11, and for boys, it begins, around 13. Obviously, this is just average, so you can have, different people starting their growth spurt at different ages. But this is what we generally see. And then, so this is where growth hormone is secreted in large amounts. And of course, what stops it, just to come back here real quick. So girls usually reach their growth spurt, they reach the end of it first, and then boys will reach the end of their growth spurt first. And to stop the growth, this is mediated by sex hormones. Okay, so growth hormone will initiate that growth spurt, but then what stops it is usually your sex hormones, okay, when they kick in. All right, so let's take a look at the flow chart. Okay, so here's our growth hormone. Okay, so what promotes the secretion of our growth hormone? So there's going to be control of the release from growth hormone by our hypothalamus, and this is going to be our growth hormone releasing hormone, right? Growth hormone releasing hormone is secreted from the hypothalamus. Let's just follow this one first, right? It's going to promote the anterior pituitary to secrete growth hormone, right? So here's our growth hormone. So that goes into the bloodstream, and it's going to, in the liver, it's going to promote the secretion of insulin-like growth factor, which is abbreviated IGF. The insulin-like growth factor, they call it insulin-like because the shape of it, the structure of it is like insulin, but it's not, and it has nothing to, really overlapping with insulin, except for growth. So insulin-like growth factors will help many tissues increase cell division, right? Make more cells, increase cell number, and other growth promoting events. So IGF, made by the liver. Growth hormone, other tissues will increase protein synthesis and also increase insulin-like growth factor. So more IGF, okay? And that's going to then provide energy and substrates for growth. Adipose tissue will start to increase the breakdown of fats for energy. It's going to decrease glucose uptake because glucose is going to be used for other cells, and it's going to then provide energy and substrates for growth. And then in muscles, muscles will then also decrease the glucose uptake and increase amino acid uptake because in growth hormone, you're going to build muscle. Growth hormone actually really promotes the increase of lean muscle mass, and it's one of the reasons why athletes will use growth hormone as a doping mechanism, because it does promote amino acid uptake and to break down fat. Okay, so it makes you leaner and more muscly, but that's going to also provide energy for growth. All right, so good. So we see a feedback mechanism, right? So we can see that there are long and short feedback loops. The short feedback loop is all in the brain. So the amount of growth hormone secreted is going to feed back to the hypothalamus. You can see this is our short feedback loop. The longer feedback loop is with IGFs. So liver, right, the IGFs can either feed back to the hypothalamus, or the IGFs can feed back to the anterior pituitary to stop the secretion of growth hormone. So those stop. Now, another item that can inhibit growth hormone is growth hormone inhibiting hormone, or somatostatin. When that's secreted, and actually stops the secretion of the anterior pituitary from secreting growth hormone. All right. So now, this is just a general, what all the tissues do with growth hormone. Then we're going to look specifically at bone. So if you forgot what osteoclasts, osteoblasts, all the bone cells were, you can review that on page 621. But growth hormone will stimulate bones to grow in width, in the diameter, and also in length. So in terms of just reviewing how bone is formed, osteoblasts will lay down osteoid. So osteoid is the organic component of bone. It is mostly collagen. Hopefully you remember this from anatomy. And the osteoid is then calcified by the deposition of minerals, calcium, phosphate, and the term of that mineralization, the mineral in bone is hydroxyapatite. So we have osteoid, the collagen, and hydroxyapatite together that make bone. When the osteoblasts secrete the osteoid, they become trapped in that matrix. They become trapped in the osteoid that they're secreting. They mature into an osteocyte. The osteocyte will maintain the bone and stay in the bone for a long time to maintain the bone and maintains the surrounding osteoid. So when bones grow, bones can grow in width. So what happens there is osteoblasts lay down new bone on the outer surface. So the bone is going to get wider, thicker by the outside. The outside of the bone is going to get thicker and build out. Then osteoclasts will resorb the bone on the inner cavity, the medullary cavity. So in a long bone, the center of the long bone will get more hollow. The medullary cavity will get larger. And this minimizes the amount of weight you're going to gain by adding new bone. Okay, your bone is still very strong, even though it has a little bit wider of a medullary cavity. Now, that's the increase in width. Increase in length is due to osteoblasts laying down new bone at the epiphyseal plate. So let's take a look at that. So this should be a review for you guys. So this is your compact bone here. We can see osteons of the compact bone on the where are we here? So we're looking at the central canal of an osteon. We have our osteocytes, right, our bone cells within lacuna of the matrix of bone. And then we're going to have on the outside of bone, on the periosteum, we're going to have a mix of stem cells, osteoblasts, and osteoclasts, and that's where we're going to enlarge the bone. This little detail here is just showing you that the osteocytes can actually communicate with each other because they are going to be joined with gap junctions, or these communicating junctions. All right, so let's take a look at, let's review the anatomy of a long bone. The epiphyseal plate is going to be a plate of hyaline cartilage that's present in children and prepubertal people who are still growing taller. So the epiphyseal plate is cartilage. And that's where we're going to start to grow and lengthen the bone, is only at the epiphyseal plate. So remember, the epiphyses are the ends of bone, the shaft is the middle part of the bone, and here's our medullary cavity, that center. So the epiphyseal plate, what's going to happen is this plate, chondrocytes, the cartilage cells are going to build up. They're going to increase the thickness of the epiphyseal plate in an upward direction. And then the cells that are closer to the shaft of the bone will start to ossify. So if here, this is your epiphyseal plate. Actually, we have a picture of it here. Right, so here's the growth of long bone. So here's our chondrocytes. Chondrocytes are cartilage cells. You're going to expand the cartilage up, right? So new chondrocytes are going to divide. They're going to be, dividing these chondrocytes, and they're creating more cartilage, pushing upwards. The lower part, the part of the epiphyseal plate that is closer to the shaft, right, this part, is going to ossify. It's going to be made into bone. So it's going to slowly creep up. The bone is going to creep up. It's going to replace the cartilage with bone. So the chondrocytes are going to eventually die and get replaced with osteocytes. All right, and so you have an area of enlargement, and then you have an area of smaller cells, because when cells divide, they start off small and then they get bigger. But that's how your bones get longer, is at the epiphyseal plate. You must first lay down the cartilage on the top of the epiphyseal plate. And at the same time, the bottom part of the epiphyseal plate is ossifying and turning to bone. If you stop making more cartilage, right? So when you stop growing, what happens is this expansion stops. No more cartilage is being made, and eventually the bone creeps up and just meets the other part of bone, and the epiphyseal plate goes away. It's now an epiphyseal line. It's just no longer, there's no more cartilage there. It's all bone, and that's when you stop growing taller. And that is mediated predominantly by sex hormones. Okay, so looking at your abnormal growth hormone, if you have a decreased amount of growth hormone in children, you have a kind of dwarfism. So you can see this picture of this woman here. She's an actress. She has a form of pituitary dwarfism where you are proportional, but you are short in stature. So because your entire body responds to the growth hormone and your entire body is missing growth hormone, your body will develop in a proportional way, but it's just not going to be very big. So that is one kind of dwarfism. There are other kinds of dwarfism. There's an achondroplasia kind of dwarfism that I'm not talking about here, but it's normally aproportional, so you're not very proportionate with that kind of dwarfism. Anyhow, so this is growth hormone. This is not going to be so common anymore in sort of industrialized societies because this is fixable. If you're detecting that your child is not growing appropriately according to their chart, the doctor can do a blood test. They can find out that the growth hormone is not there and replace the growth hormone. So you can just take growth hormone, and then that child will catch up to the rest of his or her peers. So when you see pictures like this of pituitary dwarfism or growth hormone dwarfism, it's usually just old pictures like this where they didn't have treatment, or it's from countries that have their healthcare system is not as robust. And so a lot of people may not have access to healthcare, and the pituitary dwarfism is not treated. In gigantism, you have an increased amount of growth hormone secreted, and you just get really tall. So Andre the Giant here has gigantism, very tall, but also your organs are very big, okay? And then, and I'm not sure what they do to treat this. They could maybe give somatostatin, right? Acromegaly is where you have an increased amount of growth hormone, but in adults. So the reason why children can get so tall is because they have active epiphyseal plates, right? Their long bones can still respond to growth hormone by getting really, really long. But in adults, when their epiphyseal plates are closed, there's only certain areas of their body that respond to growth hormone. There's certain bones that do this. So the frontal bone of the brow, the mandible responds to growth hormone, the hands and feet, and also the organs, so which I can't show you on this man, but the organs also get enlarged. Okay, so these are the other hormones that affect growth. Thyroid hormones are permissive for growth hormone. Insulin is also permissive for growth hormone. Sex hormones, all right, are important for the puberty growth spurt, and then they promote puberty, but then they also can trigger the stop of growing. And then glucocorticoids can also affect growth, but they inhibit growth. So glucocorticoids, we're going to talk about this in just a second, but these are stress hormones. And so stress, like increased levels of cortisol, can actually cause a stunted growth. All right, looking at thyroid hormone now. So thyroid hormone is produced in the thyroid gland, and the thyroid gland is going to look like this. So this should look familiar from anatomy. The thyroid gland has units called follicles, and inside the follicles there's a substance called colloid. And then surrounding the follicle, the cells are just called follicular cells. And the follicular cells are going to be the ones that are going to secrete the thyroid hormone, and then the colloid is going to contain the precursor to the thyroid hormone. So we'll talk about that. So we'll just do that here. So when you're creating thyroid hormone, what happens is there's a protein that's in the colloid called thyroglobulin. Okay, it's abbreviated TG. So thyroid globulin is going to get iodinized. Basically, iodine is going to come into the colloid and it's going to bind to thyroglobulin. It's going to bind to an amino acid called tyrosine. So if you look at letter A in the steps, tyrosine residues of TG are iodinated, whatever. Iodine gets bound to it. So just don't be tripped up by the word residue. It's just the amino acid tyrosine. So it can do two things. So if there's one iodine added on, it's called MIT or monoiodotyrosine, right? Because we're putting an iodine onto tyrosine, so it's iodotyrosine. Or you can add two iodine atoms on, and that's diiodotyrosine or DIT. Okay. So it turns out that when you put iodine onto thyroglobulin, they cross-link. They actually form a covalent bond. So the tyrosine residues form covalent bonds, and if two DITs, right? They're two iodine, then you're going to make T4, tetraiodothyronine, or thyroxine. And if there's one iodine and two iodines and one iodine, that's going to make T3. Okay. So T3 and T4 are your thyroid hormones, but they are stuck in the colloid bound to thyroglobulin. So when does it get secreted? By thyroid stimulating hormone, right? So thyroid stimulating hormone is coming from your anterior pituitary gland. Your anterior pituitary gland, so the thyroid stimulating hormone is coming in the bloodstream. It's going to bind to a thyroid stimulating hormone receptor. When it binds the receptor, there is a signal transduction cascade. It's mediated by cyclic AMP. So cyclic AMP activates a protein kinase. The protein kinase phosphorylates. So remember the enzyme kinases phosphorylate other things. This phosphorylation process, the secondary messenger system, allows the cell to phagocytose the thyroglobulin and T3. So it's going to take this guy inside the cell. When it's inside the cell, a lysosome is going to bind to it. So at this point here, this is called a phagosome because it just phagocytosed a molecule. So it's a phagosome. The lysosome will fuse with the phagosome. And so the lysosome, remember, contains digestive enzymes, is going to break apart the thyroglobulin from the T3 and T4. When it does that, the T3 and T4 are lipophilic. They just dissolve through the plasma membrane, dissolve into the capillary walls, into the bloodstream, and there we have T3 and T4 into the bloodstream. Okay, so the triggering mechanism of releasing thyroid hormone into the bloodstream is you need the hormone first, the stimulating hormone, but the stimulating hormone activates that follicular cell to pull in the precursor, right, sitting in the colloid, and then liberating that. So, all right, so when you talk about T3 and T4, T4 is actually secreted the most. It's the most abundant form, but it's not very active. It's 4 times less active than T3. It does help provide a long loop negative feedback. T3, triiodothyronine, is not made as much. Obviously, it makes up the other 10%, but it is more active at the target tissues. So what tends to happen is that T4 is taken up by target tissues, and then T4 is actually converted in those tissues to the more active form, T3, and that's called activation. So T4 activation happens in the other tissues of the body. All right, so just looking at the negative feedback here, we have T4 that's secreted from the thyroid gland feeding back to inhibit the anterior pituitary and also to inhibit the thyroid releasing hormone from the hypothalamus. Okay, and again, it's the T4 that does that negative feedback, not the T3. All right, so what are the actions of thyroid hormones? So the T3 and T4, they are basically control your metabolic rate, and they're secreted at a constant level all day. So it doesn't rise and fall like cortisol does or like growth hormone does. It's active all day at the same level. So what it does is it increases your body's metabolism, and there is basically increases the calories that you use. So this is called a calorogenic effect. And these are just some ways that thyroid hormone picks up your metabolism. It actually increases the rate of your sodium potassium pumps so that they work faster. It increases the number and also the size of mitochondria. So you have more energy sucking or creating organelles, right? You need more oxygen, creating more ATP. And therefore, if you have more mitochondria, it's going to also increase that oxidative phosphorylation enzymes, all the enzymes involved in the electron transport chain. It's going to enhance glycogenolysis. It's going to enhance that breaking down of glycogen. It's going to enhance breaking down protein. It's going to enhance breaking down lipids, right? Because this is all about putting your foot on the gas pedal, revving your engines a little bit higher. You're making energy. These are the molecules that will supply the cells with that energy. It's going to also promote gluconeogenesis and ketone synthesis. All right, so your thyroid hormones are necessary for catabolism. It's necessary for ATP production. It basically is your metabolic rate hormone. In development, it's really important the amount of thyroid hormone that you're making is secreted, because it has a big role in the nervous system. And if you have low amounts of thyroid hormone as an infant or as a child, that's going to affect your mental capability. So the term is called cretinism, and mental development is slowed, your growth is stunted, and you have other physiological and morphological effects from deficient thyroid hormone as a child. Now, of course, you can detect this problem. You can replace, there is T3 or thyroxine replacement therapy. One word on starvation. Starvation, if you are starving, what your body does is it decreases the metabolic rate. So you are going to decrease the amount of T3 you're making. So I have in the notes you move from a T3 state to a T4 state, because T3 is more active than T4. You'll still be producing, you're just not going to activate your T4. So your whole metabolic rate will go down, because if you're starving, you don't want your body to be using as much energy. So you're going to basically like lift your foot off the gas pedal, right? And that's why starvation diets don't work, because when you're starving, your body's going to kick into a lower metabolic rate. And so you're just not going to be as efficient with the calories that you're eating. It's not going to burn it. You're not going to burn as many calories, right? Because you're going to be in this lower metabolic rate. And just a word on hyperthyroidism and hypothyroidism. This is just to give you an idea of what these hormones do for your body if they are out of balance. So if you have more thyroid hormone than usual, remember that your metabolic rate will rev up, right? So unintentional weight loss. You are going to be burning more calories just sitting around. Your basal metabolic rate will rise, and that's going to mean that you're going to lose weight even if you are increasing the amount of food you eat. However, it's not all good. It's not all good. Your heartbeat tends to be fast. You have a pounding heart. You have an increased appetite. You might feel anxious and nervous and irritable because of this imbalance of thyroid hormone. You can have tremors. You can be sweating. You're going to feel very hot. You might have a change to your bowel movements because of the breakdown of protein. You might feel muscle weakness, difficulty sleeping, skin is thinning, and your hair gets fine and brittle. So these are all side effects of that. Hypo, too little thyroid hormone, you will feel the opposite. You'll feel very tired. Your heart rate will get slowed down. You will feel cold. Your bowels are not going to move as quickly, so you might get constipated. You have dry skin. You have gain weight, depression, hoarseness, muscle weakness. Still elevated blood cholesterol level, blah, blah, blah. So you can see thinning hair, impaired memory, cognitive issues. So just giving you an overview of what thyroid hormone can do for your body. It's a really important hormone. All right, our last hormone of this chapter is the glucocorticoids. Remember, cortisol is the most prominent one. And this is controlled by your hypothalamus, your corticotropin releasing hormone in the hypothalamus. That's going to stimulate your anterior pituitary to release adrenocorticotropic hormone. And then that's going to go to the adrenal cortex and stimulate that cortisol synthesis. This is released on a circadian rhythm. It's higher levels in the morning, sort of to get your body ready for the day. It rises and also rises in response to stress. Okay, so here is our circadian rhythm, normal rhythm, and also stressors will work on the hypothalamus to secrete its tropic hormone. The anterior pituitary will release the adrenocorticotropic hormone, moving to the adrenal cortex to release its cortisol. And then cortisol can do a negative feedback loop on both of those structures. So some actions of our glucocorticoids: it is a stress hormone, and it does the same thing that if your body's under stress, it's kind of the same thing as epinephrine does. It's going to mobilize your energy stores. So it's going to start to break down fats, start to break down glycogen, start to break down amino acids. So it acts in the same way to set up your body. And on a normal circadian rhythm, right? So if you're waking up from a fast, right? You've slept all night. You're going to start to liberate your glycogen stores, right? You sort of break those down, get some glucose into your bloodstream, get ready to start the day. However, in long, high, elevated levels of cortisol, it's immunosuppressive. So it does suppress your immune system. So if you are stressed out for a while, so if you're taking an intense class like physiology and you're stressed out, and you get sick when you're stressed out, this is because cortisol levels can suppress your immune system. This is actually used for treatment. I talked about this before. Hydrocortisone is an over-the-counter. It's going to dampen your immune response, and it's used for allergy, and it's also used for inflammation, right? So both of those are controlled by your immune system. If you dampen your immune response, you can also dampen your allergic response. You can dampen inflammation. So they use this for treatment. I have in your outline for example for decrease the swelling in arthritis. Okay, so if you have abnormal amounts of cortisol in your bloodstream, it can lead to something called Cushing's syndrome. This is hypersecretion of the glucocorticoids. And there's lots of symptoms here. Hyperglycemia should make sense because this is a stress hormone, so you want to liberate, you're breaking down glycogen, and so you're having sugar in the bloodstream. This should also make sense. If you have elevated levels of cortisol, you're going to signal protein breakdown, and so you're going to have protein depletion, and you can have wasting away of tissues. The strange thing about this is that you deposit fat in different areas of the body. So there are characteristic pads of fat around the shoulder blades to give you a humpback look. There's also a pendulous abdomen, which means that there is fat that hangs down from the abdomen. So abdomen and also the back. Connective tissue is also compromised, so you can bruise easy because the connective tissue in your blood vessels is weak. So if you hit yourself, the blood vessel breaks open and causes a bruise. In terms of hyposecretion, do I have? Yes, Addison's disease. So hyposecretion is hypoglycemia, right? Low blood sugar, and then poor tolerance to stress. And then there's, because aldosterone is also affected, you have excessive sodium retention and potassium secretion. So I couldn't find a picture on Addison's disease. It doesn't really look that characteristic, not like Cushing's disease, where there's a definite, also the deposit in the face gives you like a moon face, red cheeks, and a round face. So that is it for your glucocorticoids. And now we're going to move on to just wrapping up some questions here. So which of the following statements about the function of glucocorticoids is not correct? Okay, so glucocorticoids do not stimulate protein synthesis, right? So they're only going to stimulate breakdown. So they're going to maintain normal levels of enzymes necessary for breakdown of proteins, fats, and glycogen. Glucocorticoids stimulate gluconeogenesis. That's also a stress response, make more glucose. Glucocorticoids are required for growth hormone secretion in synergism with thyroid hormone. Yes, so this is your answer. Oh, I think I put that first question in the wrong spot. Let's move on to the second question. Which of the following is not a mechanism by which heat is lost? Okay, so remember radiation, yes. Conduction, yes. Evaporation, yes. This is your answer. That's not a way heat is lost. Which of the following hormones is not considered essential for the normal growth process? Look at your choices. The answer is oxytocin. Which of the following correctly defines hyperplasia? The answer is tissue growth owing to increased number of cells. Okay, so hyperplasia is number of cells. Which of the following is not an effect of growth hormone secretion? Okay, so growth hormone, it will increase insulin-like growth factor. It will promote protein synthesis. It will increase amino acid uptake by muscles, but it's not going to increase glucose uptake by muscle and adipose tissue. All right, and that is the end of our lecture. I just want to point out one thing. Oh, never mind. That's the end.